So hopefully in registering for tonight, you have looked at our website, vwdalliance.org. So you might be asking, what is VWD Alliance? So VWD Alliance is an organisation that was created last year by VWD patients for VWD patients and caregivers. VWD Alliance is a dedicated community for individuals and families living with VWD. And our mission is firstly to raise awareness of VWD, to provide support by bringing people together in the VWD community so that every voice is heard, and finally to educate people on what it means to live with a VWD diagnosis. Now, by raising awareness of VWD, we hope to improve access to care and ensure patients and their families have the tools they need to navigate life with VWD. So please, as I said, if you've not done so already, please join the community over at vwdalliance.org. You can stay connected and have your say specifically on the future VWD Alliance platform. So if you find the sign up form, you'll be able to say exactly what you would like from that feature. You'll also find information about the VWD Alliance team. So all of us on the homepage, that's the team. We're a lovely bunch, if I can say so myself. And you'll find out about what VWD is, what our future plans are, and also any upcoming events like future webinars. You can also follow us on Facebook, Instagram and LinkedIn using our handles. And one of the ways we can all raise awareness really easily is by sharing our VWD Alliance posts. Obviously, the more people that hear and see about VWD, the better it will be for all of us. So let's kick off with our first session of today's webinar, and I'll be discussing what does the current VWD treatment landscape look like. As I said, I'm Kat Wilder. I'm the chair of VWD Alliance, just for those who have come a bit later. I'm a VWD patient myself, and I've got I'm parent to 2 children with VWD. So I wanted to firstly go through what von Willebrand disease or VWD is, just so that we're all on the same page. It is the most common inherited bleeding disorder, affecting 1 in 100, which is up to 1% of the general population. Now, the first time I met someone with von Willebrand's disease who wasn't inside my family was a couple of years ago. And so when I heard about this statistic, it really shocked me, because I was kind of surprised that even in my 30s, I hadn't met someone outside of my family with it, and yet up to 1% of the general population has it. And VWD is caused by low levels of von Willebrand factor, or VWF, or VWF that does not function properly. Excuse me. VWF is essential for blood clotting because it acts like glue to stick platelets together to form a blood clot. So if you can see this diagram on the right, the top shows a patient without VWD. And what's happening here is where they've got an injury within the blood vessel wall, there's the formation of a blood clot. And that's because they have functioning VWF. In a patient with VWD, there is delayed or no blood clot formation because the VWF isn't there or isn't functioning properly, or it just isn't sufficient enough to form a blood clot. Secondly, VWF is essential for carrying factor VIII, and so that's why you'll often hear about VWF and factor VIII in the same conversation. Now, the symptoms of VWD include easy bruising and prolonged bleeding, and this bleeding could be anything from nosebleeds, glum bleeds, post-surgery bleeding, all the way up to joint bleeds, gastrointestinal bleeds, and also heavy periods or heavy menstrual bleeding for women. Symptoms can vary depending on which type of VWD you have, on your VWF levels, and also other genetic factors that are at play. There are 4 types of VWD. Type 1, type 2, and type 3 are genetic or inherited types of VWD, and then there is acquired VWD. Now, as I said, this is a very brief overview of VWD, but just kind of gets us all up to speed. So moving on to what the current main treatments are. So firstly, we have von Willebrand factor concentrates in the blue box, of which there are 2 types. These can be plasma derived or recombinant. VWF concentrates are administered intravenously. What this means, it's via a vein, so you need to gain access. So this might be by a healthcare professional, like a doctor or a nurse, or you might have been trained in order to administer this intravenously. And what this does is it you replace the body's missing or deficient VWF. Now, plasma-derived concentrates are made from donated human blood, and from which the plasma or clotting proteins are separated and removed and made into these clotting factor concentrates. And I've just put a couple of examples here. So Willate, Hemate P and Humate P, depending on whether you're in the States or in another part of the world, and also Voncento. These three examples also contain factor VIII. Now, more recently, there has been the generation of recombinant VWF concentrates. And recombinant just means it's made in the lab. It's not taken from donated human blood. And an example is Vivendi if you're in Europe, Von Venby if you're in the US, kind of a bit of a tongue twister. And then next up, we have something called desmopressin, which is the next main treatment, or also known as DDAVP. Now, desmopressin is also administered intravenously or can be administered as a nasal spray. And desmopressin stimulates the release of the body's stored VWF and therefore increases VWF levels in the blood. It obviously needs VWF levels to already be present. And so, for example, in, say, type 3s, where there's sometimes absolutely no VWF, desmopressin is going to do nothing. And interestingly, desmopressin is actually an antidiuretic. So it was not created specifically for VWD. It just so happens to release VWF, which is of some benefit in some types of VWD. Then next up in the pink box, we've got antifibrinolytics, and the most widely used being tranexamic acid or TXA. Tranexamic acid can also be administered intravenously or orally in the form of a tablet. And what antifibrinolytics do is they prevent the breakdown of blood clots. So what they do is they stabilize the clot. And then finally, we come over to hormonal therapy. This is specifically for women with heavy periods or heavy menstrual bleeding. These include oral contraceptives or IUDs, intrauterine devices, more commonly known as the coil. Now, these hormonal treatment options reduce the thickness of the uterine lining, which results in lighter and shorter periods, and therefore should reduce bleeding symptoms. Now, these look, I think, in theory, great, but actually, whilst these treatments generally work, the way VWD is treated hasn't actually changed much in 30 years. And studies show that people with VWD still experience problematic symptoms. And as I mentioned, the first three mostly are administered intravenously. And so that either requires that you need to go into a healthcare setting or you need to be trained. It's not the easiest to do, which we will hear from Emma about this later, which obviously is not ideal if you're in a workplace and you can't really pop to the toilet very easily and just, give yourself some factor. So really what we need, there's still room for improvement and for better treatment options. So how do these treatments compare with treatments for haemophilia? So this is a table from a paper from 2021. If you want to look up the paper, the reference is just at the bottom. And it shows the evolution of treatments for haemophilia A and VWD over the years. So you can see if we start at the top, 1960s, haemophilia A on the right, VWD on the left. Sorry, haemophilia A on the left. It's been a long day. VWD on the right. 1960s, we've got cryoprecipitate for both communities. By the 1970s, there's access to intermediate purity concentrates. By the 1980s, there's desmopressin. But then you can see here for haemophilia A, there's multiple high purity concentrates that are available. Then by the 1990s, there are multiple recombinant concentrates available for haemophilia A, but still nothing since desmopressin for VWD. Then by the 2000s, VWD has access to single high purity concentrate. And then by the 2010s, there's a single recombinant concentrate available for treating VWD. For haemophilia A, there are extended half-life variants. And then by 2020s, there are non-factor therapies, including gene therapy. So hopefully you can see in the current day, we have the furthest we've come with VWD is a single recombinant concentrate, which actually was available for haemophilia A in the 1990s. So if you can do that That's 30 years. So I think I'm safe to say that actually in the VWD community, we feel a bit left behind. And one thing I would like to mention at this point is in haemophilia, there is quite a large access, or the community is very used to administering treatments as prophylaxis. And I've just put a definition over here on the left. So prophylaxis is treatment or medicine given to help prevent symptoms. So you give it in order to prevent future bleeding, as opposed to giving it on demand, reactionary to a bleed. And so if we compare the two timelines, you can see, there's this 30-year lag. So the key question is, why is there a delay with VW treatments versus haemophilia? Now, we're going to be hearing in a minute from haematologist Dr. Catherine Ray to get her perspective on this. But if I may, I'd like to just give my personal view. I think there are three main things at play here. Firstly, awareness of VWD amongst the public and healthcare professionals is lacking. If there's less awareness, there's going to be less research, there's going to be less investment, and therefore less perceived need for more treatments for the VWD community. Secondly, I've already mentioned what prophylaxis treatment is, but this is widely used in haemophilia, but seems to be lacking for the VWD community, even though current research has shown there to be benefits in reducing the rate of bleeding episodes in patients on prophylaxis who have VWD. Thirdly, VWD has long relied on therapies that will temporarily make do. So, for example, I mentioned on the previous slides about desmopressin and the oral contraceptive pill. Both of these have secondary effects of increasing VWF. They were never actually created for VWD.